I saw this post when I was scrolling on Instagram and I wanted to make a video on it talking about insulin and what it is. Insulin is a hormone in your body that is released by the beta cells of your pancreas that helps you take up the sugar in your blood. Your cells can either use this sugar for energy so you can carry on with your daily life activities, or it can be stored in your liver as glycogen. Without insulin, your body is unable to uptake glucose and it can't use it for energy. So what it resorts to is that it breaks down fatty acids. The byproduct of fatty acids are called ketones. When you have a lot of ketones in the blood, this can become dangerous because it decreases the pH of your blood, so it makes it more acidic. This can eventually lead to something called diabetic ketoacidosis, and this is a medical emergency because it needs to be treated. So if you're a type 1 diabetic, your body is having trouble producing the insulin because the cells are being killed off by the body itself. So this is an autoimmune process. For this one, you literally have to treat it with insulin because the problem is your body producing insulin. If you're type 2 diabetic, you are releasing insulin, however, your cells are resistant to it. What happens is that because you have a poor diet, a poor lifestyle, your body's continuously releasing insulin. Eventually, at some point, your cells get used to it because they're like, man, like, we're used to this. So they stopped responding to the insulin. When you go to a doctor and you're type 2 diabetic, they tell you that, okay, you need to work on dietary and lifestyle modifications because this is the first line treatment for type 2 diabetes. Usually type 1 diabetes occurs in children, adolescents, and early teens, while type 2 diabetes is usually in adults. Some of the symptoms to look out for is increased urinary frequency. Because there's a lot of glucose in the blood, the kidneys have a threshold of how much glucose can be reabsorbed back. So any excess gets peed out. So you have to go to the bathroom and you peeing that out. Another symptom is increased thirst. So you'll be drinking a lot of water. This is because there's a lot of solutes in the blood. So that signals to the brain like, okay, we need more water. We need to dilute this out. So you're drinking more, which means drinking more, peeing out more. You can also have weight loss. One, because your body is not taking up the glucose that it needs. And two, because it's breaking down your fatty acids, so that's taking your stores out, and so you can also have weight loss with this. I'm gonna make another in-depth video about type 1 diabetes and type 2 diabetes because they have two different pathophysiology, and understanding the pathophysiology allows you to be able to better understand why doctors prescribe insulin for one as the first line of treatment, and then the first line of treatment for the other one is like, okay, we need to modify your diet and your lifestyle changes. But let me know if you have any questions in the comment down below. So yeah.